But my question to you is regarding the state of Oregon, which, as you may know, did a unique system of Medicaid expansion in which they offered, at least initially, a lottery system. And so some of the people who were eligible of this population that we're talking about got it, and others did not get it. And in their experience, from a study that I reviewed, it showed that actually those individuals who received this new entitlement, because they felt entitled, used emergency rooms at a 40% higher rate than the ones who did not receive Medicaid expansion. So I'm wondering if you're familiar with that study, if you agree with that study, and whether or not you think the same thing would occur in Tennessee, because I know under the Tennessee plan that's been proposed, there is an $8 penalty for using the emergency room, but I'm curious whether you think that having to pay $8 would be an adequate penalty to reverse that trend that we saw take place in Oregon, where in fact, ultimately it appears to me that in fact the cost actually went up of providing the health care. The only difference under Medicaid expansion is who pays for them. It's a shift from paying for them from the hospitals to now paying for higher costs paid for by the taxpayers.
I'm not familiar with the study, but I am familiar with I have heard that the emergency room visits have gone up as people have been covered. I do think the copays will make a difference. You want to have enough that, like I said, in our ER, probably easily 25-30% of the people could have other ways of care other than the emergency room. They could go to private practice offices if they had access to that. The copay, I think, is significant. I think that does make a difference and makes people think and better consumers of that. So that's one of the things I do like about this. I think there has to be some other education and there are other reasons people come to the emergency room other than their primary care doctor. That would have to be addressed too. But I think that would help. I haven't seen any studies for that or anything, but my opinion, just knowing my patients, I think it would make a difference if they had other access to.
Thank you.
And I would add that is why we are not doing a straight Medicaid expansion, but are really looking to a plan that I think specifically targets even that issue of inappropriate utilization of the emergency department. And in addition to the copays associated with that, we also envision that in the Healthy Incentives account, we will incentivize and reward individuals who do not use the emergency department inappropriately.
Senator, just real quickly, we were very familiar with that study that was done. I think there was a benefit. The benefit that was shown on the mental health side from that study. So they did see a benefit on the mental health side, but but to Dr. Long's point, that is exactly why we're doing this, because what you just brought up was our concern that we've got to be moving in the direction that actually sees outcomes, that are healthy outcomes, and so that's why we designed the program with as much, that we could, as far as we could push it to go. Ultimately, we'd like to push even farther, but that's exactly, you're making the exact point of why this is different from the traditional Medicaid program.
And so you think that $8 is enough of a penalty to discourage people from using the emergency room?
I would say that this is a start, and I think it's hard for this population. $8 is a big deal, and then also, as Dr. Taylor said, there are a lot of other things that go along with it, not just the cost sharing, but also, and we also have the premiums associated. It's a larger package you have to look at that we're trying to move them towards, much more like you would find in commercial insurance.
Okay. And Mr. Chairman, a follow-up question from my colleague is that 20 to 30%, is that typical statewide?
20-30% that don't need to go to the emergency room. I would imagine, and maybe even higher. Depends on how you define it. And you want to make a copay where it encourages people for good behavior, but you don't want to punish them when they need emergency care. So that's where you want to try to do. You don't want them to not come in because of the copay if they need help, but you do want to encourage them to consider other alternatives if they have them.
Thank you.